She thought she was just tired. That is what Margaret told her daughter on a Tuesday morning. 63 years old, retired school teacher, woman who had walked 2 miles every single morning for 11 years without missing a day. She sat down at her kitchen table, pushed her coffee cup away, and said she felt strange. Not sick, not dizzy, not like anything she could put into words. Just strange. A heaviness in her jaw that she blamed on sleeping wrong. A pressure behind her left shoulder that she chalked up to carrying groceries. And something else. Something quieter. Something she almost did not mention at all. A sensation that her heart was fluttering, fast, then slow, then fast again, like it was trying to send her a message in a language she did not know how to read. Her daughter said she should rest. Margaret agreed. She went to lie down. 40 minutes later, her daughter found her unresponsive on the bedroom floor. The paramedics who arrived said she had experienced a massive cardiac event. One of the responding physicians would later note, quietly, in the hallway outside the emergency room, that the fluttering sensation Margaret had described, what most people would casually call a palpitation, had almost certainly been present for days, maybe weeks, and that if someone, anyone, had told her what that symptom actually meant for a woman over 60, she might have made a very different decision than lying down to rest. Here is what nobody tells you. The symptoms that kill people over 60 are not always the ones you have been trained to recognize. They are quieter. They are easier to dismiss. And one of them, one of the most dangerous warning signs your heart can produce, is so common, so ordinary sounding, that millions of people experience it every single week and do absolutely nothing about it. Stay with me. Because by the end of what you are about to hear, you will never look at that symptom the same way again. The physician who spent the most time thinking about Margaret's case, and cases like hers, is Dr. Thomas Mercer. He is a cardiothoracic surgeon with 31 years of experience and over 2,000 open heart surgeries to his name. He has held beating hearts in his hands, literally. In the operating room, with the monitors screaming and a surgical team waiting, there is no room for the kind of comfortable vagueness that fills most medical conversations. You see what is happening inside a human chest, and you understand very quickly that the heart does not negotiate. It does not give second chances. And it does not always announce itself the way the textbooks suggest. Dr. Mercer spent years frustrated by the same pattern he kept seeing. Patients who came in too late. Patients who had been having symptoms for weeks, sometimes months, who had mentioned those symptoms to family members, or even to a general practitioner and been reassured. Reassured that they were stressed. Reassured that they were getting older. Reassured that what they were feeling was probably nothing. He watched families in waiting rooms. He watched the moment when a nurse came out and the news was not good. And he made a decision to start talking about what he was seeing. Not in medical journals, not in conference rooms, but directly, clearly, in language that any person could understand. Because the system, in his view, was failing people at the most basic level. It was not giving them the information they needed to make decisions that could save their own lives. Here is the first thing you need to understand. The body that is 60, 65, 70 years old is not the same body that was 40. This sounds obvious, but its implications for how you recognize a cardiac warning sign are profound, and almost nobody explains it this way. Think of your cardiovascular system like a suspension bridge. When that bridge is new, it has enormous tolerance for stress. You can drive heavy trucks across it, let the cables flex and strain, and the structure absorbs the load. But as a bridge ages, the cables stiffen. Small cracks develop in ways that are invisible from the surface. The same load that once crossed without incident now creates stress fractures in places you cannot see. The bridge still looks fine from the outside. It is still carrying traffic, but its margin for error has changed entirely. One study published in the Journal of the American College of Cardiology found that adults over 60 are approximately 3 times more likely to experience what is called a silent cardiac event, a serious problem with the heart that produces symptoms that are not the classic, crushing chest pain most people expect. 3 times more likely to have a heart attack that announces itself as jaw ache, as shoulder heaviness, as fatigue, as a fluttering in the chest that comes and goes. Write that down. The first symptom you must never ignore is heart palpitations. And before you say you already knew that, stay with me. Because there is a specific version of palpitations that is catastrophically underestimated in people over 60, and there is a very good chance you do not know what it is. A palpitation is any sensation that makes you suddenly aware of your own heartbeat. It can feel like a flutter, a thud, a skip beat, a racing, a brief irregularity that makes you put your hand on your chest without quite knowing why. Most people who experience palpitations have experienced them for years. They are common. They come after too much coffee, after a stressful phone call, after a bad night of sleep. And because they are common, and because they almost always go away on their own, they have been categorized in most people's minds as a nuisance, an inconvenience, not a warning. Here is where the danger lives. There is a condition called atrial fibrillation, known as AFib, that affects more than 6 million Americans, and that becomes dramatically more common after the age of 60. In AFib, the upper chambers of your heart begin to beat chaotically, out of sync with the lower chambers, creating exactly the kind of irregular, fluttering sensation that Margaret described at her kitchen table. And AFib is not simply uncomfortable. It is one of the most significant independent risk factors for stroke that exists. People with undiagnosed or untreated AFib are 5 times more likely to have a stroke than the general population. 5 times. And because the rhythm irregularity in AFib can come and go, appearing for a few minutes, disappearing for hours, returning without warning, many people with the condition dismiss it for months, sometimes years, before it is ever diagnosed. What makes this especially dangerous for people over 60 is that the aging heart's electrical system becomes less reliable, less consistent in its signaling, and an irregular heartbeat that might have been purely benign at 40 can be a symptom of a far more serious underlying condition. At 65, the mechanism changes, the risk profile changes, the urgency changes, and the feeling, that flutter, that irregular thud, can feel identical. If you are over 60 and you have ever placed your hand on your chest and noticed your heart beating in a way that felt uneven, irregular, or faster than normal, and especially if that sensation lasted longer than 30 seconds or has happened more than once, that is not something to rest through. That is a conversation that needs to happen with a physician who can perform an electrocardiogram, starting tonight. Have you ever experienced that flutter and told yourself it was nothing? Drop the word yes in the comments right now. You would be surprised how many people are reading your same story. The second symptom that is directly linked to sudden heart attacks in people over 60 is jaw pain or tooth pain with no dental cause. This one surprises people every time. And that surprise is exactly why it is so lethal. The heart and the jaw share nerve pathways. When the heart is under significant ischemic stress, when blood flow to a section of the heart muscle is being compromised, the pain signal can travel upward through a shared neural network and register not in the chest, but in the lower jaw, the back teeth, or occasionally the throat. Cardiologists have a term for this, referred pain. And in women over 60 especially, it is one of the most commonly misread warning signs of an impending cardiac event. Not because women are less attentive, but because nobody told them it was possible. Nobody explained that a nagging ache in the lower jaw that comes on during physical activity and fades at rest is not a dental problem. It is a cardiac alarm. Dr. Mercer has operated on patients who spent 3 weeks going back and forth between a dentist and a primary care physician, each dismissing the other's explanation, while the real problem, a significant blockage in a coronary artery, continued silently. By the time the cardiac cause was identified, one of those patients required emergency bypass surgery. Another did not survive. If you have jaw pain that comes on when you exert yourself and goes away when you rest, that pattern matters. That pattern is the flag. Now, before you continue, ask yourself this. Have you ever mentioned a symptom to a doctor and been told it was probably nothing and believed it without pushing further? If the answer is yes, stay with me. Because what comes next is the part most people never hear. The third symptom linked to sudden heart attacks is swelling in the feet and ankles, specifically new swelling that has appeared in the last several weeks without a clear explanation. This is the symptom most people skip past entirely. They see the swelling. They think it is age. They think it is standing too long. They buy compression socks and move on. But here is what is actually happening when unexplained swelling appears in the lower extremities of a person over 60 with no recent change in medication or lifestyle. The heart, when it begins to fail, even mildly, even in early stages, loses some of its ability to pump blood efficiently forward through the circulation. Blood backs up. Fluid begins to leak out of the vessels and pool in the lowest points of the body, the ankles, the feet, sometimes the calves. This is called peripheral edema, and it can be one of the earliest visible signs of heart failure, a condition that is far more treatable in its early stages than most people realize. But only if it is caught. Only if someone connects the swelling to the heart and does not simply accept it as an inevitable feature of getting older. Here is what nobody tells you. Heart failure does not always feel dramatic. It can begin quietly, with puffiness around the ankles at the end of the day, with shoes that suddenly feel tight in the afternoon when they fit fine in the morning, with a slight breathlessness climbing stairs that did not exist 3 months ago. These are not signs of aging. These are signs that something is changing in the cardiovascular system and that the body is working harder than it should to maintain circulation. Write that down. The fourth symptom is extreme, unexplained fatigue, and not the kind that a good night of sleep fixes. Fatigue is the most universally dismissed symptom in older adults. Everyone is tired. Everyone has reasons to be tired. But there is a specific quality to cardiac-related fatigue that is different from ordinary tiredness, and once you understand the difference, you will not confuse them again. Cardiac fatigue is disproportionate. It means that tasks that cost you almost no energy 3 months ago, walking across a parking lot, making a meal, having a conversation while doing something else, now leave you needing to sit down. It means that rest does not restore you the way it used to. It means that the fatigue has a physical heaviness to it, a sense of effort that starts before the activity has even really begun. This happens because a heart that is not pumping efficiently cannot deliver adequate oxygen to the muscles and organs of the body. The body responds by rationing, by prioritizing, by shutting down discretionary energy use so that the vital systems keep running. You feel the result of that rationing as tiredness, as needing more sleep than usual, as a heaviness in the limbs that you cannot quite explain. One of the reasons this symptom is so dangerous in people over 60 is that it overlaps so completely with what most people, including most physicians, expect aging to feel like. The cultural story we tell about getting older is that you slow down, you get tired more easily, you need more rest. That story is true to a point, but it has become a mask behind which real cardiac warning signs hide for weeks and months at a time. If your fatigue has changed in quality or intensity over the last month, if it feels different, heavier, more persistent, that change is worth investigating. Tell us in the comments. When did you first notice your energy was different? Not less, different. Your answer might help someone else recognize the same thing. The fifth symptom is shortness of breath that comes on without an obvious trigger. Not breathlessness after running upstairs. Not being winded after something genuinely strenuous. The version you need to know about is breathlessness that arrives unexpectedly. Waking up in the middle of the night feeling like you cannot get enough air, and then finding that sitting upright on the edge of the bed makes it better. Feeling suddenly short of breath while sitting still, having a conversation, or lying down in the evening. These are not anxiety attacks. They are not panic. They are a signal from the cardiovascular system that fluid is moving into places it should not be, often into the lungs, because the heart is not managing pressure the way it should. The medical term for nighttime breathlessness that improves when you sit up is paroxysmal nocturnal dyspnea, and it is a recognized warning sign of heart failure that requires evaluation. If it has happened to you more than once in the last several weeks, it belongs in a conversation with a cardiologist. Not tomorrow, soon. And if someone you love has mentioned waking up unable to breathe and you brushed it off as a bad dream, call them. Today, there is a question that has stayed with Dr. Mercer since early in his career, a question that a patient's husband asked him in a hallway that he has never entirely been able to set aside. The man's wife had just come out of emergency surgery. She had survived, but it had been very close. The husband looked at Dr. Mercer and asked quietly why no one had ever told her that what she was feeling was serious. He was not angry. He was genuinely puzzled. His wife had mentioned her symptoms to 3 different people in the weeks before her cardiac event. 2 family members, 1 general practitioner. All 3 had offered some version of reassurance. All 3 had told her she was probably fine. And the husband's question, why does no one tell people what these things actually mean, was one Dr. Mercer did not have a satisfying answer for in that moment. He has spent a great deal of his professional life since then trying to make that answer exist. Standing in operating rooms, looking at the damage inside human chests that arrived there after weeks of ignored warnings, he understood something that he wishes were taught far earlier and far more widely. Ordinary people, doing ordinary things, making coffee, watching television, getting ready for bed, are living with symptoms that their bodies are using to communicate something urgent. And they are not ignoring those symptoms out of carelessness. They are ignoring them because no one gave them the framework to understand what those symptoms mean. The waiting room families he has seen. The husbands and wives and adult children who sat in those chairs, not knowing. That is the failure, not the patient, the information. His patient Robert Hensley was 67 years old when he came into the clinic, having lived with periodic palpitations for 4 months, ankle swelling that had been present for 6 weeks, and a fatigue so persistent that his wife had stopped mentioning it because mentioning it seemed to make him feel worse. He had been to his regular doctor twice. Both times he had been advised to cut back on salt and monitor his blood pressure. When Robert finally came in for a cardiac evaluation, not because of any new symptom, but because his daughter, who had been doing her own research, insisted, the echocardiogram told the full story. Early-stage heart failure with reduced ejection fraction. Significant atrial fibrillation contributing to the palpitations. Beginning intervention at that stage made it possible to restructure his medication, his diet, and his activity in ways that changed his trajectory entirely. Within 14 months, Robert had gone from 4 medications to 2. His ejection fraction had improved measurably. His palpitations had resolved with proper rhythm management. He told Dr. Mercer on a follow-up visit that the thing that stayed with him most was not the diagnosis, not the treatment. It was the realization that he had been carrying this for months, that his body had been telling him, and that the information he needed to hear it had simply never been given to him. That question has stayed with Dr. Mercer. Let us bring this together clearly. 1. Palpitations. Irregular, fluttering, or racing heartbeat that recurs or lasts longer than 30 seconds. Never dismiss this in someone over 60. It may be atrial fibrillation, and atrial fibrillation raises stroke risk 5-fold. 2. Jaw or tooth pain without a dental cause, especially pain that comes on with exertion and fades with rest. This is referred cardiac pain, and it is consistently under-recognized, particularly in women. 3. New swelling in the feet and ankles that has appeared in the last several weeks without explanation. This can be the earliest visible sign of heart failure, and it demands evaluation, not compression socks. 4. Disproportionate, persistent fatigue that rest does not fix. If the quality of your tiredness has changed, if tasks that were easy are no longer easy, that change is information your heart may be sending you. 5. Unexplained shortness of breath, especially at rest, at night, or that improves when you sit upright. This is a recognized cardiac warning sign that requires professional evaluation promptly. Here is your comment prompt for today. Which of these 5 symptoms have you or someone you love experienced and dismissed? Be specific, not just the symptom. What did you tell yourself to explain it away? Your answer is not just a comment. It is a reminder to someone reading below you that they are not alone in what they felt and ignored. That exchange, that moment of recognition between strangers in a comment section, that is the kind of information sharing that the system was supposed to be doing all along. If this has been useful to you, share it right now before you continue. Not because of views or algorithms, because the person who needs this most is probably not searching for cardiac warning signs. They are somewhere feeling strange and calling it nothing. They are living with a flutter they have learned not to mention. They need someone who has already heard this to think of them and send it. That person can be you. Subscribe if you are not already here. Turn the bell on. The next video covers a nighttime habit that sharply increases the risk of a cardiac event in the hours before dawn, a window of danger that almost no one knows to protect. You will want to see that one. One final thing. Everything discussed here reflects the real knowledge that surgeons like Dr. Mercer carry from decades of operating rooms and patient care. But it is not a substitute for your own physician's evaluation of your specific history, your current medications, and your individual cardiovascular profile. Use this as a starting point. Use it to ask better questions. Use it to take something seriously that you might otherwise have set aside. Your heart has been working for you every single minute of every day since before you took your first breath. It has never asked you to stop. It has never taken a break. It is not too late to give it the attention it deserves. It is never too late.